A patient suffering from chronic obstructive pulmonary disease, COPD, refuses to meet anyone, including family members. Which impact of the illness is the patient showing? Select all that apply. 1. Impact on family role. 2. Changed self-concept. 3. Health prevention. 4. Coping. 5. Illness symptom. Answer. 1. Impact on family role. 2. Change self-concept. Rationale. The patient is experiencing an impact of illness on self-concept. A patient who refuses to interact with family members is also experiencing an illness reaction, which impacts the family role. Illness behaviors are a patient's reaction to the disease and a way of coping with the disease and its adversities. Behaviors are generally influenced by the way the patient perceives the illness to be, and adverse reactions are based on those perceptions. Refusing to meet anyone is not a symptom of chronic obstructive pulmonary disease, COPD. Health prevention is a way of preventing health problems from occurring. How can nurses who provide care in long-term care settings best enhance the self-esteem of older adults who reside in these facilities? A. Maximize the autonomy of residents in organizing their routines. B. Provide opportunities for the residents to engage with children and teenagers. C. Ensure that residents are not presented with tasks that carry a risk of failure. D. Encourage residents to talk openly about their opinions. Answer. A. Maximize the autonomy of residents in organizing their routines. Rationale. Maximizing autonomy and control is likely to enhance the self-esteem of older adults who may be very aware of their increasing dependence and loss of control. Encouraging frank discussion and interaction with other generations are also positive interventions, but these are less direct methods of fostering self-esteem. It is inappropriate to completely remove all risk of failure from older adults' activities. A nurse encourages a client to say, "I can't seem to do things right the first time I try them," instead of saying, "Nothing ever goes right for me." The nurse is focusing on which of the following? A. Self-evaluation. B. Community-based support. C. Therapeutic relationship. D. Behavioral change. Answer. D. Behavioral change. Rational. The nurse is implementing the nursing intervention of behavioral change by helping the client accept responsibility for self. Using I statements is desirable as opposed to reflecting thoughts and feelings. A more active statement helps the client realize that he has the power to change the behavior. With a therapeutic relationship, the nurse focuses on conveying empathy and a sense of friendship. Nursing interventions that assist clients with positive self-evaluation can help change poor self-concept. Here, the nurse would emphasize the positive attributes rather than the negative behaviors. Community-based support involves the use of community resources such as support groups, referrals, or individual teaching. A client with a diagnosis of colon cancer has required the creation of an ostomy following bowel surgery. What factor is most likely to influence the client's adjustment to this change? A. The specific location of the ostomy. B. The prognosis of the client's cancer after the surgery. C. The client's knowledge of a peer who also has an ostomy. D. The coping mechanisms that the client possesses. Answer. D. The coping mechanisms that the client possesses. Rationale. While having a peer with a similar challenge is likely to facilitate adjustment to a change such as this, the most significant consideration is likely the client's own coping mechanisms. This factor supersedes the client's prognosis or the location of the ostomy. A client with cancer has a family who is emotionally supportive of the client. Having a supportive family is which type of resource? A. External resource. B. Financial resource. C. Internal resource. D. Professional resource. Answer: external resource rationale. A person's situational support is considered an external resource, whereas a person's coping mechanisms are internal resources. A healthcare professional is a professional resource. Financial resources are provided by income, benefits, and contributions. The nurse is assessing for information about a client's self-concept. The information needed first is about which of the following? A. Gender identity. B. Sexual orientation. C. Personal identity. D. Body image. Answer: personal identity rationale. When assessing self-concept, the information needed first is the client's description of self. Personal identity describes an individual's conscious sense of who he or she is. Sexual orientation may not be how someone identifies themselves or may only be a small part of their personal identity. Body image and gender identity may also be only part of their self-identity. The pediatric nurse is caring for a boy 5 years of age who is being seen in the clinic today. He is very worried that the doctor may harm his body. His mother asks the nurse if this is normal for this age. The nurse shares with the mother that the very young child worries about which of the following related to his body? A. Sexuality and style. B. Fitness and energy. C. Intactness and mutilation. D. Rapid changes. Answer: C. Intactness and mutilation rationale. The young child is fearful of bodily mutilation and desires very much to have an intact body. The adolescent worries about the rapid changes occurring to the body. The adult is concerned with fitness, energy, sexuality, and style. What term best describes a person's sense of his or her own adequacy and worth? A. Self-actualization. B. Esteem. C. Self-esteem. D. Love. Answer: self-esteem rationale. Self-esteem is a person's sense of his or her own adequacy and worth. Which of the following factors is most likely to present a challenge to the self-concept of a man 79 years of age? A. Assisting his grandchildren with their college tuition costs. B. Financial pressures associated with the depletion of his savings. C. The realization that his children are themselves undergoing age-related changes. D. The man's increasing level of dependence on his children. Answer: D. The man's increasing level of dependence on his children. Rational dependency near the end of life can present a significant challenge to an individual's self-concept. Helping his grandchildren with the costs of education and facing financial challenges may be difficult, but these are likely less of a threat to self-concept than the realization of decreasing independence. The aging of the man's children is less likely to affect his own self-concept. The ICU nurse is caring for a man 63 years of age who has had a stroke. He is on a ventilator and is not expected to live. The physician has recommended to the client's wife that her husband be made a DNR patient. As the nurse talks with the client's wife and tries to comfort her, she recalls from prior reading that Aguilera described 3 factors that determine a person's response to crisis. Those factors are the person's. Choose all that apply. A. Perception of the event. B. External resources. C. Internal resources. D. Church support group. E. Family and friends. Answer: A. Perception of the event. B. External resources. C. Internal resources rationale. Aguilera, 1998, described 3 factors that determine a person's response to crisis. 1. The person's perception of the event or situation. 2. The person's situational supports external resources. And 3. The coping mechanisms the person possesses, internal resources. The rehabilitation nurse is caring for a female client aged 62 years who has suffered a stroke and has recovered with only mild weakness of her left leg. One of the rehabilitative goals for the client is to attain and maintain adaptive patterns of behavior related to socialization and communication. Which of the following would indicate that she is achieving this goal? Choose all that apply. A. Communicates needs. B. Frustrated related to need for help. C. Accepts help. D. Acts as a support for others. E. Isolates self. Answer A. Communicates needs. C. Accepts help. D. Acts as a support for others. Rationale. Adaptive responses to socialization include maintaining usual social patterns, communicating needs, accepting offers of help, and serving as support for others. Maladaptive responses to socialization include isolation, exhibiting superficial self-confidence, and unable to express needs, becomes hostile, ashamed, frustrated, depressed. Which development stage is particularly crucial for identity development? A. Infancy. B. Young adult. C. Adolescence. D. Preschool age. Answer C. Adolescence. Rationale. Adolescence can adversely affect self-concept and self-esteem. Which of the following statements about body image is correct? A. Body image refers only to the external appearance of a person's body. B. Physical changes are quickly incorporated into a person's body image. C. Perceptions by other persons have no influence on a person's body image. D. Body image is a combination of a person's actual and perceived ideal body. Answer D. Body image is a combination of a person's actual and perceived ideal body. Rationale. Body image involves attitudes related to physical appearance, structure, or function. Examples: amputation, facial disfigurement, or scars from burns. Robert, who is 2 years old, is praised for using his potty instead of wetting his pants. This is an example of learning a behavior by A. Imitation, B. Substitution, C. Identification, D. Reinforcement extinction. Answer D. Reinforcement extinction. Following a bilateral mastectomy, a 50-year-old patient refuses to eat, discourages visitors, and pays little attention to her appearance. One morning, the nurse enters the room to see the patient with her hair combed and makeup applied. Which of the following is the best response from the nurse? A. What's the special occasion? B. You must be feeling better today. C. This is the first time I have seen you look this good. D. I see that you've combed your hair and put on makeup. Answer D. I see that you've combed your hair and put on makeup. A patient diagnosed with major depressive disorder has a nursing diagnosis of chronic low self-esteem related to negative view of self. Which of the following would be the most appropriate cognitive intervention by the nurse? A. Promote active socialization with other patients. B. Role play to increase assertiveness skills. C. Focus on identifying strengths and accomplishments. D. Encourage journaling of underlying feelings. Answer C. Focus on identifying strengths and accomplishments. Several staff members complain about a patient's constant questions such as, should I have a cup of coffee or a cup of tea? And should I take a shower now or wait until later? Which interpretation of the patient's behavior helps the nurses provide optimal care? A. Asking questions is attention-seeking behavior. B. Inability to make decisions reflects a self-concept issue. C. Dependence on staff must be stopped immediately. D. Indecisiveness is aimed at testing how the staff reacts. Answer B. Inability to make decisions reflects a self-concept issue. A depressed patient is crying and verbalizes feelings of low self-esteem and self-worth such as, I'm such a failure, I can't do anything right. The best nursing response would be to A. Remain with the patient until he or she stops crying. B. Tell the patient that it's not true and that every person has a purpose in life. C. Review recent behaviors or accomplishments that demonstrate skill ability. D. Reassure the patient that you know how he is feeling and that things will get better. Answer A. Remain with the patient until he or she stops crying. An adult woman is recovering from a mastectomy for breast cancer and is frequently tearful when left alone. The nurse's approach should be based on an understanding of which of the following: A. Patients need support in dealing with the loss of a body part. B. The patient's family should take the lead role in providing support. C. The nurse should explain that breast tissue is not essential to life. D. The patient should focus on the cure of the cancer rather than loss of the breast. Answer A. Patients need support in dealing with the loss of a body part. When caring for an 87-year-old patient, the nurse needs to understand that which of the following most directly influences the patient's current self-concept. A. Attitude and behaviors of relatives providing care. B. Caring behaviors of the nurse and healthcare team. C. Level of education, economic status, and living conditions. D. Adjustment to role change. Loss of loved ones and physical energy. D. Adjustment to role change, loss of loved ones and physical energy. A 20-year-old patient diagnosed with an eating disorder has a nursing diagnosis of situational low self-esteem. Which of the following nursing interventions would be best to address self-esteem? A. Offer independent decision-making opportunities. B. Review previously successful coping strategies. C. Provide a quiet environment with minimal stimuli. D. Support a dependent role throughout treatment. Answer A. Offer independent decision-making opportunities. The nurse asks the patient, "How do you feel about yourself?" The nurse is assessing the patient's A. Identity. B. Self-esteem. C. Body image. D. Role performance. Answer B. Self-esteem. The nurse can increase a patient's self-awareness through which of the following actions? Select all that apply. A. Helping the patient define her problems clearly. B. Allowing the patient to openly explore thoughts and feelings. C. Reframing the patient's thoughts and feelings in a more positive way. D. Have family members assume more responsibility during times of stress. E. Leave the patient alone to think about self. Answer A. Helping the patient define her problems clearly. B. Allowing the patient to openly explore thoughts and feelings. C. Reframing the patient's thoughts and feelings in a more positive way. When developing an appropriate outcome for a 15-year-old girl, the nurse considers that a primary developmental task of adolescence is to A. Form a sense of identity. B. Create intimate relationships. C. Separate from parents and live independently. D. Achieve positive self-esteem through experimentation. Answer A. Form a sense of identity. An appropriate nursing diagnosis for an individual who experiences confusion in the mental picture of his physical appearance is A. Acute confusion. B. Disturbed body image. C. Chronic low self-esteem. D. Situational low self-esteem. Answer B. Disturbed body image. In planning nursing care for an 85-year-old male, the most important basic need that must be met is A. Assurance of sexual intimacy. B. Preservation of self-esteem. C. Expanded socialization. D. Increase in monthly income. Answer B. Preservation of self-esteem. Based on knowledge of Erickson's stages of growth and development, the nurse plans her nursing care with the knowledge that old age is primarily focused on A. Intimacy versus isolation. B. Autonomy versus shame and doubt. C. Generativity versus self-absorption. D. Ego integrity versus despair. Answer D. Ego integrity versus despair. The home health nurse is visiting a 90-year-old man who lives with his 89-year-old wife. He is legally blind and is 3 weeks post-right hip replacement. He ambulates with difficulty with a walker. He comments that he is sad now that his wife has to do more for him and he is doing less for her. Which of the following is the priority nursing diagnosis? A. Self-care deficit toileting. B. Deficient knowledge regarding resources for the visually impaired. C. Disturbed body image. D. Risk for situational low self-esteem. Answer D. Situational low self-esteem. Rationale. Situational low esteem is having a negative perception of self or capabilities or response to change or loss that changes situation due to happenings, such as a loss of functional abilities or body parts. Based on knowledge of the developmental tasks of Erickson's industry versus inferiority, the nurse emphasizes proper technique for use of an inhaler with a 10-year-old boy so he will A. Increase his self-esteem with mastery of a new skill. B. Accept changes in his appearance and physical endurance. C. Experience success in role transitions and increased responsibilities. D. Appreciate his body appearance and function. Answer A. Increase his self-esteem with mastery of a new skill. Example of perceived inability to meet parental expectations, harsh criticism, and inconsistent discipline. A. Identity. B. Self-esteem stressors. C. Role performance. D. Role overload. Answer B. Self-esteem stressors. An adolescent attempting to adjust to the physical, emotional, and mental changes of increasing maturity. Internal sense of individuality, wholeness. M. Consistency of a person over time and in different situations. A. Identity. B. Self-esteem stressors. C. Role performance. D. Role overload. Answer A. Identity. Situational transitions, the way in which individuals perceive their ability to carry out significant roles. A. Identity. B. Self-esteem stressors. C. Role performance. D. Role overload. Answer C. Role performance. Unsuccessfully attempting to meet the demands of work and family while carving out some personal time. A. Identity. B. Self-esteem stressors. C. Role performance. D. Role overload. Answer D. Role overload. Example of a middle-aged woman with teenage children assuming responsibility for the care of her older parents. A. Body image. B. Role conflict. C. Role ambiguity. D. Role strain. Answer B. Role conflict. Common in adolescence and employment situations. A. Body image. B. Role conflict. C. Role ambiguity. D. Role strain. Answer C. Role ambiguity. Example of providing care to a family member with Alzheimer disease. A. Body image. B. Role conflict. C. Role ambiguity. D. Role strain. Answer D. Role strain.